So in this question, we see a client on a medical unit recently received a diagnosis of end-stage renal disease. So your patient diagnosed by end-stage renal disease, and this is the chronic medical condition, chronic disease, and was told for dialysis. Hmm? So if anybody diagnosed by the chronic renal disease or end-stage renal disease or CKD, the treatment option go for dialysis or kidney transplant. Usually transplantation take time to prepare the patient, and time being we chose for dialysis. This morning the client was found in the bathroom and trying to commit suicide by hanging using hospital ground tie. So this is the psychiatry patient, and this patient is try for the suicide. Suicide means intentional act of killing oneself, right? The client was stabilized, transferred to the psychiatric unit. The patient was in medical unit, end-stage renal disease, decide for dialysis, suddenly attempt for suicide. Why? When anybody diagnosed by terminal disease, they undergo to the depression. So depression is a risk factor for the suicide. Chronic disease is a risk factor for the suicide, right? So we have to find out what are the risk factor of the suicide. As a healthcare provider, it is very important to interact with the patient. Nursing care is important. So they said, which of the following is the first priority? Highest priorities. Keep in mind, when a question comes about the suicide or psychiatry or psychiatric disorder, safety is the most important. Safety is the first priorities, right? Number one, assessment. The client risks for another suicide attempt. Yes, assessment is important. The patient who tried to attempt for suicide, they will chance go for next attempt. Assessment of the risk factor we find out. Second, encouraging the client to express the current feelings about the medical diagnosis. So verbalized, this is the therapeutic communication. Important. Place the client in a private room. No, never, ever. So the patient who under the threat of suicide, we never allow them private room. Number one and two is important, but not the highest priority. Provide the continuous one-to-one observation because safety is important. It is the most important, highest priority. Otherwise, after the number four, encouraging verbalized, find out the risk factor also important, but our choice is the number four because of the priority, safety priority, one-to-one observation, right? So what is the explanation? What are the explanation? This client has made a suicidal attempt and is at the highest risk for additional suicidal behavior, right? So my patient tried to or made an attempt of suicide, they have a more chance do same thing in future. Therefore, the priority safety is most important. The client priority need for safety. The best nursing action is to provide one-to-one contact, so the client to ensure constant observation, and also that the client does not engage in self-harm. The presence of nurse will also convey a sense of acceptance, concern, and caring, and also provide opportunities for the client to express their feelings about the current chronic disease or medical diagnosis. So you allow them to verbalize their feelings. This is the therapeutic communication. So when you communicate with our patient, we try to minimize the distraction, discuss their health in private setting, right? So allow them, give them plenty of time for the patient to respond your question. It is important. Now, what are the additional note or nursing intervention if a patient have a suicidal ideation, right? So they said the intervention, we removing the sharp and other potential harmful object. Here we are going to talk about the nursing care or intervention. So we remove all sharp objects, other potentially harmful objects like belt, metallic eating materials, tie, glass stuffs from the client environment. Make sure the client swallow their medication. Also supervision the client during eat or food meal, placing the client in a semi-private room near to the nurse station, so you can easily go or attempt when need. Making round at irregular interval for the client who does not need the constant observation. Encouraging the client to express their feelings, especially anger, or having an open and honest conversation with the client about the changing the suicidal rates. So, what are the most important about this? We provide one-to-one constant supervision, very important. And also we document the patient behavior every 15 minutes, right? And also here we mention some stuffs or such belongs at the admission. Remove all dangerous objects like metal or silverware, belt, towel, razor, plastic object, glass, even shampoo or perfume. So only allow the patient to use the plastic silverware, some books said. And here, give them semi-private room. Do not place the patient in private room. ask your patient to agree to a non-suicidal contact. And make sure patient swallow their medication. Recognize the behavior that may indicate intention to commit suicide. And what else? What are the education objectives? The priority of nursing action for the client who has made a recent suicide attempt is to ensure the client safety. The best approach is to provide one-to-one contact and constant supervision. I want to share with you what are the risk factors of suicide and what are the protective factor and also the priority of assessment. So what are the risk factor of the suicide? What are the protective factors and priority of assessment important for NCLEX board? The risk factor, let me explain one by one. If the untreated depression or any other mental illness encouraging patient for the suicide, family history or prior suicide attempt, chance of go for the next attempt for suicide. Chronic health problem like chronic kidney disease or CKD, HIV positive patient, cancer patient, very bad road traffic accident patient, or substance abuse or substance use disorder like alcohol abuse, drugs abuse. If anybody suddenly loss of job or loved one, or cultural risks, what does it mean? The cultural risk factor means like American Indian or American Alaskan, Alaskan Native. These ethical groups is more chance to go for the suicide. So if your patient has an attempt or suicide, how we should protect it? Protective factors. So encouraging your patient go for religious practice. So religious belief protect for the suicide. Social support network can work. Effective coping skill or adaptation with present condition or access to healthcare, also protective factors. So as a healthcare provider, what is the assessment of your patient? So assess the patient risk factor of suicide. Means you ask some leading question your patient, like, does the patient have a plan for suicide? How lethal it is, how dangerous it is? Or does the patient have the access to intended method, like they have any gun, they have any excess of gun or poison? We have to find it out. So therapeutic communication is super important here. Make a trustable relationship, ask the question and find out the clues. Also, has the patient had a sudden change in mood from sad to happy or peaceful? It indicates, or this may indicate, an intention to commit suicide. it is important for our NCLEX board.